Hello and welcome to The Agenda. This week, Representative Melissa Minor Brown, affectionately known in her community as Mimi, is going to talk to us about a lot of things today. Hopefully, we're going to get in depth in regards to the health of women in our community. We're going to talk about House Bill 379. We're going to talk about why she became a state representative. Representative Brown, welcome to the show.
Thank you for having me.
It's a pleasure. Your first time on The Agenda. We'll go easy. We'll ease into this. So right now, this is your, I guess, almost your third day here at our studios because you've been on almost a health summit in regards to maternal women's health.
So really, in relation to Black maternal health.
Okay.
I could give you some national statistics if you want, but you know what, I'm not even going to waste time on that. I'm just going to tell you, for one, the U.S. is one of 13 countries in which Black maternal mortality is on the rise. And we're talking about preventable, life-threatening complications related to maternal mortality and infant mortality. And Delaware actually ranks 28th in the nation in regards to infant mortality.
28th in the nation.
28th in the nation. This small little state.
Right. With less than 1 million people, around a million people.
Yes.
Give or take. We are 28th in the nation in regards to maternal health, or is that infant, what are we again?
28th in the nation. And I don't have the exact numbers right now. For what I know is that Black women are dying 2.5 to 3.5 times faster than white women during childbirth and during pregnancy. And Black babies are dying 3 times faster than their white counterparts.
What is it that we can do before then to really prevent that?
So everyone says we need to educate.
Right.
And yes, we do. But we have to be careful saying that because it comes off as if we need to educate the Black woman on how to care for herself. And we're not going to make this an issue where it's the Black woman's problem that they're dying faster than white women. Mm-hmm. Okay. So the thing is, it's about educating Black women on how to advocate for themselves.
Yes.
But there's so much work that we need to do to ensure that Black women actually have access to quality healthcare.
Right.
That's important. We need to address the bias that exists.
Right.
Because when it comes to maternal mortality, we're talking about the social determinants that impact Black women. And one of those social determinants is racism. We need to talk about it, because it's a real thing, which is why one of the bills that I just actually filed addresses implicit bias within our hospital systems and our birthing centers.
And how has that been going with the local healthcare systems here? Are they allies in helping and dealing with these issues, or are you getting pushback, or what have you experienced so far?
I'm getting a little bit of both, but it's okay because this is a great time to educate people, right? Like when I say that every single person who is employed by that facility needs implicit and explicit bias training, that's a real thing.
Right. Your
experience starts from the moment you walk in the door of the hospital. The person who parks your car, the person behind the desk who may have you sitting in the room in pain, not realizing that because you're a strong Black woman, that your pain is not as intense and you may not be in the phase of labor where you're about to deliver. Mm-hmm. Even the janitor needs this training. Mm-hmm. So, and I guess the thing is, folks don't realize that bias does exist. And it's the people who say, I'm not biased, are the ones who actually need it. We all have biases. Mm-hmm. But yeah, so I mean, majority of the individuals that I've talked to about this legislation, they're on board. Some of our facilities are already doing this, just not with every single employee. And then there are some that we just need to educate, and eventually they'll jump on board.
So this isn't something that is just foreign to you, right? You've worn the scrubs, you've been in the halls. Tell us about your nursing career.
Ooh, well, let me just tell you, nursing is the reason why I am in politics.
I've heard this story. Please tell me about it.
Okay, so I literally, I gotta say, I rose from the bottom to the top, right? Like teen mom, went to school, became a nursing assistant, literally quit my job because I was denied assistance for emergency assistance for an electric bill. And I realized that my neighbor was receiving assistance and she wasn't working and I was working. So I kind of got upset, like on that whole, the system is designed to keep you down piece. Mm-hmm. That is a real thing. Okay. So I literally went back to social services the next day and was like, I'm quitting my job. I'm going back to school. I'm going to be a nurse. I was kind of rude about it though. I was young. So I was like, I'm going to be a nurse and I'm going to make more money than you one day. But
well, you were determined. Let's not say rude. You were just determined.
Yes,
right.
I was determined. And I'm glad that I was, because I literally went back to school, became a nurse, LPN, then RN, then bachelor's and master's. So I've been in different areas within the healthcare arena. But one thing that remained consistent was that I was always complaining. I'm always complaining because I feel like
You saw opportunities.
I saw opportunity, and I saw, like we talk about issues that are preventable within the Black maternal mortality epidemic. It's the same thing, just within the healthcare system. You're like, if we just change this one little thing, we could improve the quality of life of so many people. And I felt like I wasn't being heard. So I would say the tip of the ice, I mean, I worked at the VA hospital for 8 years.
Okay.
I left to go out into the community. And everyone's like, why would you leave, a government job?
Government job that can take care of you forever.
Yeah, take care of you. But you have to be able to feel like you're making a difference, within your job.
Right.
So I went out into the community and worked for community ACT teams and worked for Department of Corrections and became a director of nursing over a senior living facility. Continued to complain about things that I felt were so fixable. I remember sitting with one of my 97-year-old residents and helping her pharmacy shop because
Pharmacy shop, I don't understand.
Pharmacy, because she could not get her blood thinner covered. At 97 years old, why is your blood thinner not covered?
Right.
That's a problem.
That's
I
a
mean,
huge problem.
you should not even have to think about that. That's a life-saving medication. So between that and then one of my patients actually passing away, David. So David was homeless and he had Medicaid and he had unmanaged schizophrenia. And the nurse practitioner ordered a certain medication for him, which was an injection. And think about being homeless, one thing you're not thinking about every day is taking multiple pills.
Right.
So she ordered a medication for him and his insurance denied it, of course, right? They're like, no, you need to try all these other meds first. And then once you fail at these other meds, then we'll give you the medication that your provider prescribed. So taking pills 3 times a day, and then you fail at those, and then you then try another medication, fail at that, then another. So there was 3 failures that had to happen before he could get the medication that was a monthly injection. And we knew that we would see him every month. Well, he ended up playing around with matches in his motel room, and he passed away. So that's when I was just like, you know what, enough is enough. And actually the first bill that I passed once I got elected was step therapy that put safeguards within that space so that if you are denied the medication that your provider prescribes, there's another route that you can take so that you can get that medication.
So that's what led you to the 17th district and this, I guess, new job, new career of leadership in your community was just being fed up of these experiences. After working in the healthcare system for so long, you just kind of said, enough is enough. I'm ready to become a change agent.
Yeah, I just was like, you know what, I'll just fix it myself then.
Hey, let me tell you something. I believe that it is a strong possibility that you will be able to fix it. But what makes you want to become a state representative? Now, mind you, you have several people that are watching, and there are people that have come from, a similar situation that you've gone through, right? There could be somebody at home right now thinking, what am I going to do? I'm fed up with this system. I mean, what would you tell them right now and how you got to where you are right now?
I would literally say, be an advocate, do something about it, because eventually you just get tired of complaining.
Right.
And that's where I was. And when I actually ran for election, when I campaigned, I was not a politician, right? So I'm knocking on people's doors and I'm like, I'm not a politician. I'm just a nurse. My patient died.
Right.
I have a son. How was he at the point? He was 5 then. And I'm like, he goes to this certain school and he was called animalistic by his teacher, and I'm like, come on. The percentage of minority children in the school that he was in was like, what, 2%? So just thinking about those kitchen table conversations.
Right.
And that was it. But I definitely let my future constituents know, I don't have a huge stump speech for you. I can't come in here and tell you how I'm going to save Delaware.
And fix all your potholes.
And fix all your potholes. But I'm a mom, I'm a nurse, and I'm tired of complaining.
And you're ready to do something.
And I'm ready to do something about it.
Well, I don't think we can ask for much more than that from a politician, but what we can ask for is that we feel comfortable enough that our legislation is being passed, is being reviewed, is being debated without that same implicit bias that happens in the hospitals that you're trying to prevent. I feel as though sometimes it's happening at the state legislation down in Dover, and ensuring that that is being thought of when bills are being created. Have you noticed any of that?
So this is the point where I was about to like shake my head, and I was like, you know how you just shake your head sometimes when people are talking, and I was like, maybe I shouldn't shake my head right now, depending on who's watching. They might be like, oh, she just basically confirmed what he just said.
Well, I'm not. No, I don't want to dig a hole. But I mean, how are we ensuring that that isn't happening? We'll say that.
Let's just say this is the first time ever that there have been 12 African Americans in the legislature in Delaware.
Wow.
At one time. You know, there's always been 1, 2, or 3 here or there. You know, 3, then 2, then 1, then 2, then 3. But with us being there, you know, we definitely bring different experiences. We come from different backgrounds. We've experienced, you know, let's just say our experiences are just different. We're Black. You know, we're born into this world with like everything already up against us.
2 strikes.
Yes. So it gets tough though, because you don't want to, you're never coming off offensive when you're not coming off offensive when you are bringing forth legislation that uplifts the community that you come from, that uplifts minorities. But it can easily be perceived as that, as being offensive, because you may get well, this doesn't happen, or I'm not racist, or, you know, just some folks may feel offended. Mm-hmm. I'll just say that. But that leaves room for education.
Which is necessary. All throughout our lives, all throughout our careers, constant education is necessary, and especially in the times that we are now. So I don't feel that education is this, not another, you know, I had to sit through a sexual harassment training last week, and you know what? I learned something new.
Yeah.
You know what I mean? I had to sit through a reporting seminar. It was great. You know, now I'm certified, what have you. But it's important to continually have those conversations.
Well, and this is the thing, right? Like, we're going off of data.
Right.
Data is data. Data does not lie.
Data-driven decisions.
It's there. That is real, you know, and the disparities that exist, the data proves that they exist. And the disparities that exist, they come from the inequities that exist right here in our state. So it's not us just making this up. Right. We're not just saying, hey, you know, there are minority communities, there are low-income communities that do not have access to quality health care. There are low-income communities that do not have access to healthy foods, you know, or quality education. We're not just making it up. Right. This is what the data proves it. You know, the data proves that Black women are 3 times more likely to die than white women during childbirth.
And these are still in neighborhoods where people do pay taxes.
Yes. Well, you know what? You know what's interesting though? So, and I love to talk about this when it comes to Black maternal health, because this part, when it comes to Black maternal mortality, it doesn't discriminate. So the data has shown that a Black woman with an advanced college degree is more likely to die than a white woman with less than a high school diploma.
So it completely stomps the stereotype that people may think this is just another woman of color that
Let's educate that Black woman.
Sucking into the system, not doing it.
She's at high risk for high blood pressure and heart disease, you know, not realizing that, okay, listen, we done been through a lot, okay?
Right.
Like, we're very resilient. But did you ever think that sometimes some of those risk factors come from the stressors that we face every single day from the moment we walked on this earth?
So from a legislative standpoint, we've established these are educated people. We've established that these are tax-paying residents. These are home-owning residents, but they're still facing this, right? So I'm looking at this in the gyroscope of legislation and activity. We're still kind of dragging our feet as far as getting things done in Dover in regards to this issue.
Well, I wouldn't say we're dragging our feet.
Okay.
I wouldn't say we're dragging our feet.
Thank goodness.
I will say there's processes that need to be followed. So when I first got elected, I just wanted to change the world like this, right? I was like, you know what? This needs to be done. That needs to be done.
Representative Brown, now, it's 2022.
It is.
There's processes, but this issue in regards to mortality of infant mortality, healthcare of women of color is not a new issue.
And it shouldn't be something you have to prove.
It shouldn't be something. I mean, we acted very strongly in regards to COVID.
Mm-hmm.
I mean, it happened in 2020. We had legislation later that year, moved forward, it protected citizens so we didn't have a mass situation, right? Why is it so hard now that we're dealing with this issue? So when I say, are we dragging our feet, and you're saying there's processes, what is it? Like, why is this so hard?
You know what? We're not going to see a difference when it comes to Black maternal mortality. We're not going to see a difference when it comes to mortality within the African American population. We're not going to see a difference addressing gun violence and the reduction of gun violence.
Which is a healthcare issue.
Which is a public health crisis.
Right.
We're not going to see a difference until we address gun violence, until we address the inequities in healthcare the same way we address COVID. When we prioritize that.
With the same level of energy.
Yes, we have to be intentional. This is what I want to do. I want to reduce the amount of gun violence that's happening right now in Delaware, in the city. And when we are intentional about it and we dump resources into it, quality resources, not just fluff, like quality resources, then we will see a difference.
Let DART do the driving. DART First State provides transportation that is clean, safe, reliable, and affordable. Plan your trip and get real-time bus information with the free DART Transit app. Scan your phone to pay your fare with the free DART Pass app. So what are you waiting for? Try transit today. Visit dartfirststate.com or call 1-800-652-DART.
So I know you have 7 bills right now that you have. Correct me if I'm wrong. Is it
Yes.
7? 7 bills right now that you're trying to get through in regards to healthcare in our state. Tell us a little bit about those. I want to make sure that you get those out because I have a feeling that you and I, we could go on for hours in regards to this, but I want to make sure that you're talking about these.
Yeah, so the Delaware 2022 Momnibus, okay, and 2022 because there's going to have to be a 2023, right? Because we're going to continue until the disparity no longer exists.
This isn't a one and done.
Yeah, the disparity has to be non-existent before we can just stop. All right, but the 2022, so House Bill 234, that is a bill that expands Medicaid to 1 year postpartum.
And I'm putting these on the screen for us. So right now we're dealing with House Bill 234.
Yes,
okay.
And that's the only one you're going to get a number for because that's the one number that I remember. But 234 is, it expands Medicaid to 1 year postpartum instead of cutting it off at 60 days because 60 days is just not long enough. A woman, she just had a baby and we are literally cutting off her Medicaid, 8 weeks later, you know, and usually many times postpartum depression does not even present until closer to the 1 year mark, maybe around a 9-month mark, right? So we need to expand that.
Okay.
Let's see. In relation to Department of Corrections, there's 2 bills. One is for the Department of Corrections to create a midwifery doula program.
Okay.
And to ensure that women who are under their custody have access to a doula and or a midwife during their pregnancy.
Okay, let me stop you there. What would you say to the constituents out there that say these people have committed the crime, they have taken away from me, this is their punishment, I don't have that, why should they?
First, I would say you deserve to have that.
Right.
So every woman should have access to a doula. But prison is supposed to be rehabilitation. Could you imagine, well, you may be able to, you can. Do you have kids?
I do, I have 3.
Imagine your child just not being with you, just being taken away from you, right? Is rehabilitation really going to be effective? So we're talking about women who may go into the prison pregnant. First of all, we need to make sure that they have that doula, not only for their physical health, but for their mental health.
Okay.
Because can you imagine a woman losing her baby and then has to go back to the prison setting? How can you even cope? Is that true rehabilitation? I would want to die. You would have to have me on psychiatric close observation if you take my child from me.
Right.
So they need they just need all the cushion that they can get while they're incarcerated. If we really want to rehabilitate, in prison it's supposed to be rehabilitation. So if we really want to stand by that mission to rehabilitate people, we need to make sure that we're providing those resources to women. And honestly, 90% of individuals who are incarcerated are going to get out one day.
Absolutely. And they deserve to be parents when they're out.
Absolutely.
They never stop being parents. They never stop being parents.
Yeah, and maybe you need a little help. Maybe you don't even, I don't know why you ended up in this space. And it could be generational. I don't know what type of parent you had. Maybe, I don't know why. It's so funny because when I think of prison, I think it's all related to mental health. It is. We got to remember adverse childhood experiences.
Socioeconomic conditions
absolutely
affect the outcome of the child's development. Which can end them in a situation where they become an offender.
It's sad when you can look at a child and say, oh, he's going to end up in prison one day.
Right.
Instead of looking at that child and saying, okay, we don't want him to end up in prison one day. What can we do right now to address those issues, to provide interventions, to wrap our arms around this child and uplift them and show them that they have value,
right,
instead of allowing them to even enter the juvenile justice system and then the adult justice system. Oh my God, there's so much work we need to do in Delaware. I worked in every prison in this state, so.
Again,
that just took me away from the mom to this.
We have 5 more bills that we have to get through.
Yeah, so the other bill related to Department of Corrections is so right now, you can only not shackle a pregnant woman if she is in labor and in the process of delivering a child.
Okay.
So this bill expands it to postpartum, and it also expands it to women who are in their second and third trimester of pregnancy. So we should not be shackling women who are pregnant, period. So we just should not be shackling pregnant women.
These are still offenders, though.
Okay.
That may have violent tendencies.
Well, okay, so in an extreme circumstance, but.
And we have to think about officer health.
We have to think about officer health, but we should not. Okay, so imagine a woman 8 months pregnant.
Okay.
And we're putting shackles on her ankles and her wrists to take her out to her maternal fetal medicine appointment.
There may be another way to restrain.
Or do we have to restrain? Where's she going? The data has shown that no pregnant woman has tried to go anywhere.
Representative
We don't have any
Brown,
stats showing that.
She's in jail, though.
Okay, and she's still a human being. And the only way that we are going to rehabilitate that woman is if we treat her like a human being.
Okay.
So that's what we're going to do. We're going to show her that her life has value. We don't know what she's been through.
That's true.
Yep.
That's true.
So the other bill tasks Delaware Medicaid to come up with a plan on how they are going to reimburse doulas through Medicaid.
Oh, okay, that sounds good.
And they're going to present that plan in November.
Okay. Is it finalized? They're presenting the plan, but has it been finalized?
They are working on it. They're doing the research, and I know that for sure because I am the chair of the doula ad hoc working group under the Delaware Healthy Mom and Infant Consortium.
Well, you made it clear that you were going to be right there and hands-on in your somewhat stump speeches that you made, right? So you're continuing that and making sure that that's positive. We have 2 more left.
We have 2 left.
2 left.
Let's see. So temporary assistance for needy families, also known as TANF.
I love that.
Yes. So that bill actually removes the work requirements for a pregnant woman.
Okay.
So if you are 8, 9 months pregnant and you're receiving any type of cash assistance from the state,
okay,
right now you have to actually look for a job. And you have to prove that you have gone out and you have done a job search every week. So this bill exempts you from that job search. But
pregnant women aren't big walkers sometimes.
They're not big walkers. But the good thing is, though, instead of having to go out and look for a job, there are going to be plenty of educational materials that you can look at from home. There will be parenting support groups, lactation support groups, all types of modules to
because these are new parents too.
Yes.
Regardless, these are new parents that are unaware of what to do and might not have generational help to guide them through this. So those programs are absolutely necessary.
Why not? So that'll be good.
Right.
And then there's the other bill. It makes some changes to the Maternal Mortality Review Commission.
Okay, tell me, this is interesting to me because we've talked about the data, right? So what does this commission do with the data that it's collecting?
All right, so this commission reviews all maternal mortalities and infant mortalities, and they come up with interventions, and they give us our data. But what my bill does is it ensures that they include socioeconomic factors. We want to know what that woman's zip code was. We want to know what her race and ethnicity was. Also, so this is a governor-appointed commission.
Okay.
So it also tasks the governor to make this commission more diverse. So we want community members, we want a doula or a midwife on this commission. Mm-hmm. So, our doulas are working out in the community. They're working, with some of our women who
front lines.
Exactly. So they need to be a part of this. And it also ensures that this commission holds public listening sessions. So they are going to present their data to the public in all 3 counties and receive feedback.
Now, in any of these bills, and I'm just asking you, and it may not be and you may not know, are there people coming to, because I've found that my wife works in healthcare, and I found that a lot of people are open to now physicians and medical professionals coming to them, because those people going sometimes to the doctors because they don't want to deal with that. They don't want to go to the clinics. So now we have to bring it to them. Is any of that legislation supporting those efforts?
So that is not, but there are some other things in the works.
Okay, great.
Such as remote patient monitoring, which will allow for pregnant women to be, and individuals with chronic diseases to be monitored at home. And then we're looking at of course, Representative Bentz and Senator McBride, they did a telehealth bill, which is good.
It's great.
Yeah, it's a good bill. But I also, House Bill 21 and 141 centers around nurse practitioners, advanced practice nurses.
Oh, that's awesome.
Our nurse practitioners, they go out into the areas where most doctors don't go, or more rural areas or more low-income communities.
That's what I love to see.
Yes, so this bill actually grants them independent practice so that they can go out into these communities and serve where the need is great.
That's what I love to see. Mm-hmm. Now, before we go, we only have a couple minutes left. Some Delawareans are getting ready to get some money, right? There's a $300 bill that's out there.
Yes, the relief rebate bill.
Yes, tell us a little bit about that.
Are you ready for you want your bill? You want your check?
I'm married with 3 kids. I get an allowance. So if it helps with my allowance, I'll take it.
I hope my husband's watching this. Yeah, he needs to know he's only getting an allowance to maybe.
Maybe. It's on a week-by-week basis.
And what's mine is mine.
Absolutely. It's on a week-by-week basis, and I get gold stars or X's.
Yeah, so this bill, it's a good bill, and this bill was created due to the inflation in gas prices and grocery prices. So this bill will give every Delawarean who filed taxes in 2020 a $300 check, which they should get by the end of May.
Okay, great.
And there was something else I wanted to say about this bill. Oh, and for our seniors who don't file taxes anymore, they still are eligible to receive the check.
Too. Okay.
Yes.
So that's awesome, and everybody's happy to hear that. End of May, check your accounts, check your mailboxes, because the check is coming.
The check is coming.
The check is in the mail.
Yes, and listen. When I fill up my gas tank now, it's like $84.
I don't even look anymore.
Yeah, and I'm not getting plus. I'm getting 87. And I have an Explorer. I'm like, nope, give me the 87. I want regular.
I want regular today.
Yep.
Quickly, what's out there? What's on your agenda for your district and you over the next week or so?
So my district just expanded. So I'm picking up Delaware City.
Oh, great.
Which is good, right? I have 2 municipalities now, Old Newcastle and Delaware City, which I just love. But right now, we are already planning for our next 17th District Day. It usually falls around the fall. It was in October last year. It'll probably be in October this year, and it's huge.
The 17th District Day.
17th District Day. It is huge. We have food trucks. It's free.
Where can they find out more information about this?
I'll send it to you.
Please.
It's going to be on my website. It will be on, it'll be everywhere.
Okay, cool.
You'll see. Follow my Facebook page.
I will.
It's Rep. Melissa Minor Brown. Super. Are you already following it?
I am now.
No, you know what? That's messed up.
Right now.
Okay.
Right now. Mentally, I just clicked.
As soon as we're done, you need to get your phone.
I just clicked on it right now. It's done.
Yes, you need to know. You need to be out there. DETV was out there last year.
Well, it's one and the same.
It's a big deal, though. I mean, there's so many resources. There's fun stuff for the kids. Food trucks are free. Everyone just come out, have a good time, get some information. You can literally adopt a dog at 17th District Day. And you can get on the spot mental health counseling at 17th District Day.
I'm there.
If you need to see a therapist today, you go right there. Not today, but on 17th District Day. It's right there. Just go on over there and they're there. It's a good deal.
Sounds like something that we all need to go to. Representative Brown, thank you very much for being on the agenda.
Thank you for having me.
Thank you, Representative Brown, for being on the agenda this week. Thank you, Representative Brown, for ensuring that people's health care or is it on the agenda? That women's and maternal health is staying on the minds of state legislatures, and that you are enacting laws and regulations to ensure that all Delawareans are getting adequate health care, equitable health care. We look forward to those conversations and many more right here on the agenda. You have a great week.